most of us will have many doubts and queries regarding the cancer and its related treatment. So the two important questions which most of us will ask is whether the cancer incidence is increasing at present and what is the real cause of the cancer. So as the first question, the incidence of cancer is increasing. When we compare to 1970s and 1980s, the cancer incidence was around 70 cases per 1 lakh population. But when we come to 2015, it's around 120 cases per 1 lakh population. So definitely the cancer incidence is increasing, and in the future also it's going to increase. So what is the real cause of this cancer? If you ask what is the real cause of cancer, there is no answer. Or why someone is getting cancer, we can't really answer that question, why someone is really getting cancer. But if you take the incidence of a cancer as an overall, around 40 to 50% of the cancers are preventable cancers. So what is preventable cancer? So preventable cancers are cancers which we can prevent by modifying our lifestyle. So as I already told, 40 to 50% of these cancers are preventable. So among these 40 to 50% of preventable cancers, more than half of the cancers is due to our lifestyle, and especially more than 50% of these cancers are because of tobacco. So as we know, tobacco is very dangerous, and some of the very carcinogenic elements in the tobacco smoke can cause cancer. As we know, especially carcinogens like tar, parammonic hydrocarbons, nitrosamines, these very highly carcinogenic compounds which is in the cigarette smoke is highly carcinogenic, and they can cause cancer. So as we know, usually we talk about nicotine. The nicotine is usually an addictive substance in the cigarette or the cigarette smoke, but the real cancer which is causing the cancer are the tar, the nitrosamines, and there are many hundreds of compounds like this. So tobacco, which all cancers, so as we know, highly susceptible for lung cancers and also oral cancers, food pipe cancers, throat cancer, stomach cancer. So all these cancers incidence are at present increasing because of tobacco. So as I told, more than 50% of the preventable cancers is because of tobacco. And if we come to the next reason, the next important reason is going to be alcohol. So among this preventable cancers, around 20% of the cancers because of alcohol. So alcohol also can cause cancers from any part of the body, especially from the oral cancer, stomach cancer, esophageal cancer, liver cancer. So all these cancers are also highly susceptible for alcohol. And definitely everyone will have doubt regarding the lifestyle and the dietary habits. So if we come to the dietary habits, we can't pinpoint to a particular food that this food is going to cause cancer. It's nothing like that. Scientifically, we can't tell this particular food is going to cause cancer. But what is the main etiology of the cancer, especially when you take in females, the breast cancer and the endometrial cancer? Obesity is one of the most important risk factor of developing cancer, and also lack of exercise. So obesity and lack of exercise, so what are the food which is contributing to this can definitely cause cancer. So there are also few other causes like increase in radiation, increase ultraviolet rays, all these things will add. But the main add-on or main causes of these preventable cancers are smoking, alcohol, and also our food habits, especially the junk foods, obesity, and lack of exercise. So if we take individually the cancers in males and in females, as we know, the cancers in males, the most common cancer at present is the lung cancer. As we know, definitely it is because of the tobacco and smoking. So when talking about tobacco, it's not only the cigarettes or the BDs, but also the smokeless tobaccos are also equally harmful. So one of the second important cancers in males are the oral cancers. So as we know, the oral cancers are basically because of smokeless tobacco. So smokeless tobaccos are also equally harmful like what we are smoking, like the tobacco content in the cigarette or in BDs. So coming to the females, the most important, the cancer which is in the first is the breast cancer. As we know, previously it was the cervical cancer, the cancer of the uterus. Cervical cancer was one cancer which was the first in females, but at present the breast cancer has really overtaken the cervical cancer. So this is partly because of the awareness among the general public. Their lifestyle has modified, lifestyle has changed in such a way. At present, the most important or the first cancers in females is the breast cancer. So definitely the next question is what are the symptoms of cancer, or how can we prevent it? So as we know, like all cancers or disease, early prevention is always better, and prevention is better than cure. So as we know at present, especially if you take breast cancer, so we have to dictate this breast cancer as early as possible. For example, the most of the time the breast cancers present with present like a small lump, or there will be some nipple discharge. So any of these symptoms, if you are coming across, you have to immediately consult the concerned doctor, and we have to take necessary steps and actions regarding it. So coming to the treatment, so what are the treatment options available in cancer? So as we know, the treatment options in cancer is mainly divided into three. So we have something called chemotherapy, radiation therapy, and also surgery. So it depends upon the type of cancer, it depends upon the site of cancer, and the modality of the treatment vary according to the site and type of the disease. So usually in any cancer center, we'll have a multidisciplinary team, and every cases will be discussed in this team, and according to the stage of the disease and according to the site of the disease, we will decide which therapy to be given. So sometimes the patient may require only one modality. If it's a very early stage, we can finish the treatment with only one modality, but most of the times our patients will get all these three modalities like radiation, surgery, and chemotherapy, depending upon their site and type of the disease. So next important question or worry among most of the people is they're mostly worried about the treatment and the side effects of the treatment. So at present, there is nothing to worry about the side effect of the treatment. This worry can be easily removed by a proper counseling. So a proper counseling before the treatment is the most important part of the treatment. As we know, previously everyone was worried about vomiting because of chemotherapy. If you see some 20 years back, almost 90% of the patients, one of the important side effect was vomiting. But at present, because of our very newer therapies and newer drugs, this vomiting is not at all a problem now. Most of our patients, they won't complain of vomiting now. So with initially before starting a particular therapy, we will be guiding them and we will be counseling them regarding the treatment and what are the probable side effects, so they can be prepared what are the possible side effects. So at present, most of the side effects can be easily managed, and we have very advanced techniques and methods to decrease these side effects at present. So then these are the main modalities, as I told: chemotherapy, radiation, and surgery. These are the main modalities of the treatment at present available in cancer treatment. And also there are some of the newer therapies are coming, like targeted therapies, immunotherapies. So these maybe in next 5 to 10 years, it will be the immunotherapy and targeted therapy can completely replace the chemotherapy. So as we come to this sort of treatment like immunotherapy and targeted therapy, one of the important thing is the side effects. The side effect profile is completely different, and it is much easier tolerable than the other the routinely using chemotherapy. So another and a frequently asked question is whether this cancer can spread, or whether can transmit from one person to other person. So that is a definitely no. Till now, we don't have any scientific evidence that this cancer will spread from one person to another. At present, the cancers usually, if you sit with the cancer patient, if you sleep or if you eat with the cancer patient, the cancer usually never spreads from person to person. Then also regarding most of the patients will ask about what is their normal life, what happened to their normal life after the treatment. So definitely everyone can lead a normal life after the course of treatment. After they complete the course of chemotherapy or radiation or surgery, they can be back to a very normal life, and they can lead a very normal life, and whatever they used to do, they can continue on their routine works. There won't be any difficulty in continuing their routine works. So the last point I have to stress here is most of will ask how to follow up a patient or what they want to routinely do after completing the treatment. So this is one of the important point regarding the treatment of cancer. So all the patients after the regular chemotherapy or surgery or radiation therapy, they should be under a regular follow up with their consultant physician. So it can vary according to the site of the disease and type of the disease. For few patients it will be monthly, for some it will have 3 monthly, for some it will be yearly. So it will entirely depend upon the site and type of the disease. But this is a very important part of the cancer treatment, that they should be under a regular follow-up. So why a regular follow-up is required? So even though it is an early stage or whatever the stage of the cancer, there is a chance that this cancer can recur or relapse. So we should be on a regular follow-up so that we can early identify this recurrence or relapse, so that we can early start treatment for the recurrence. And even in the recurrence, if it's in very early stage, we can identify it is still completely curable. So I want to again stress on this part, that even after the complete treatment or completing the treatment of a cancer, you should be on a regular follow-up with your consultant physician.